Good morning. Oh, wow. Today is another day, and then we give thanks to the Almighty God for giving us life. It's good to have knowledge always, and it's good to have it at this time. You see, the brain functions well when its burdens are less. And this morning, I think many of us we are not thinking of much, unless maybe we get up and then walk through life to face a lot of difficulties. That is where we will start to think. But now I think we can concentrate on the books, and I believe it will help us in the nearest future. I'm your facilitator for today. Emmanuel Gyamfi is my name, and then currently a BSc student in diagnostic medical sonography. I've also achieved a lot of certificates and a few too, which is by the help of my dearest friend, a mentor, a doctor, and then my everything. By the help of him, Dr. Patrick, I'm able to do so and then move forward. I thank SNN for this great opportunity given to me for us to discuss the role of sonographer or sonography in modern medicine. So today my lectures will be around the duties, the functions, how we function in the clinical settings, how we function in various departments being sonographer. But then I will limit myself only to only to the duties. But I believe before we know our role and duties, we must know our origin. For it is says somewhere, maybe in the account Proverbs, that if you forget your blah, 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 you begin to lost. Yeah. So you know how to become sonographers and then the skills needed. We will also dealt a little bit with problems and then benefit for sonographers. Yes.
Can all of you mute your mic, please?
Oh, dog.
Yes, and indeed, we will talk about the legal aspect of sonography. For this one, we won't be able to go into details much since I'm not a legal personality, but then we will brush through and then see what we can do. It won't take much time. So we can finish early and then we proceed to the 3P method. If you talk about medicine, it's a broad topic and it's a broad theme. Though the understanding is many, but we can think of the commonest and the simple one being drugs administered to us, which the Oxford Dictionary define it as so. And we can also think about it as a practice of science, which involves diagnosis, treatment, preventions, and other stuffs to it. Today, our lectures and our understanding in medicine will be only limited into the diagnostic department. So, as I said earlier, the medicine field is a broad field which involves a lot. And this involvement, we can talk of the psychology department, we can talk of the physiotherapy, we can talk about the diagnostic department, department for research, department for treatment, and limiting ourselves to the diagnostic department, this is a place where we do investigations. So it is not only for the ultrasound people or the radiologists, it's for the labs where we take sample, we analyze the sample, and then we also give reports about it. Yes, we also have a lot of fields: the acupuncture, the traditional herbalist, the homeopathy, the therapeutic, the Chinese tradition, and then more. But for today, we will only limit ourselves. I think I'm getting feedback. I don't know whose mic is on. We will only limit ourselves to the department which deals with diagnostic. And this diagnostic department, we will only dwell on the imaging. That is the diagnostic imaging. Even at the diagnostic imaging, we will further degrade ourselves to only the ultrasound department, which is the diagnostic medical sonography. So if you say diagnostic medical sonography, is a branch of medical imaging, and it uses its machines, which has less ionizing energy and actually wave energy to produce image for us to assess the image, whether in 2D, 3D, or in any form of image. So we are talking about a medical sonographer. And here we are saying a medical sonographer must have high skills in using specialized equipment to create image in the body and internal organs. In fact, I must cite example from here onward that our shifts and our brain coordination will be guided toward the role of sonography in modern medicine. You can go and claim for parentship of a certain child that you don't know. But then when it gets to legal obligations, and when your case is being forwarded to the courts, you will be asked, what is your role or your impact to this child that you are claiming to be the father or the mother? And this question will be answered according to how you related to the person, for the person who you are to him, or for yourself who the person is to you. That is why I entitled my presentation, Who is a Sonographer? So knowing your roles, knowing who you are, becomes your functions and your duty in the modern medicine or in the clinical setting. So as we get to know who sonographer is, it is the same functions, it is the same duties that becomes our role in our clinical settings. I hope at this point we are good to go. Yes. So we sonographers, being highly skilled, is our role. Yes, you must acquire a lot of skills. And the skills, since it is competitive, the skills must be highly. Then sonographers use images to help doctors to detect tumor cysts, blood clots, and other problems. And again, we do assess fetus during pregnancy. We have certain instances which our country here, if it is being there. I don't know, it will be less. Where we have emergency ultrasound, where in the theaters and then in the emergency rooms where we have EFAST, in the times where when there is cases, we can do a quick scan to rule out certain instances. In some countries, for you to become a sonographer, you must attend to the medical school, have your medicine, then you specialize in the course. But then for our area here, we will talk about how to become one. Then you must have a core knowledge in ultrasound physics, at least how the machine works, cross-sectional anatomy, at least the areas that you want to work around. You must have the anatomical knowledge about the organs of interest. Then you must at least have physiological knowledge about how things goes, and then indeed the pathological aspect of it, where we grab it with a highly force. That is where our power comes. Oh, this is myoma, this is this. If you are able to understand and then to detect that, you also have a very highly skilled, and that should be your role too. So limiting ourselves to who we are, and then limiting ourselves to our duties. Let's go into details. So the diagnostic medical sonographer, that is the person in the action of sonography, having the ability to undergo a certain educational process, coming out with a lot of practicals to scan using the ultrasound machine to evaluate and analyze the internal and external structures of bodies, including organ of interest, to rule out a certain pathologies and condition for the doctors to use his or her reports and the image to diagnose and then to treat. In fact, for Ghana here, if you ask of sonography and a sonographer, in all our constitution, it says that a sonographer must be an allied health professional who specializes in the ultrasonic image device to produce diagnostic images, scan videos or 3D or 4D of anatomy and diagnostic data for the doctors to review. So it's better to have your licenses under the Allied Health training program. Then you become a qualified sonographer, which you will be allowed to do a lot of things. Yes, due to high level of decisional attitude and diagnostic input, sonographers have a high degree of responsibility in the diagnostic procedure. So you must specialize very well. You must have a bit of educational background and a health background, which will help you to work as a sonographer very well. Then there is this thing that is very important. Being a sonographer, you can advance yourself to become a sonologist. And in this condition, you become a doctor, medical doctor. You go additional medical ultrasound training to diagnose, and this one, you treat diseases. So sonologists, unlike radiologists, who always give reports for radiologists, they give reports, but for sonologists, you will be allowed to give treatment. Then you will be lances too. And these lances will not be the Allied Health lances for being sonographer. These lances will be a medical certificate. Then you can consult. You will use the ultrasound machine to, evaluate. And when there is any evaluation being around the diagnostic ultrasound medical centers, it is you that they will refer to. Again, you may practice as a sonologist, you may practice multiple specializations, such as you will be an obstetrician, gynecology, heart emergency and vascular, headaches, and the rest, because you've specialized in ultrasound to become more an advanced sonographer, and your name now is sonologist. That is your role as a sonographer too. You can upgrade yourself. And a major role that sonographer must keep in mind that sonographers are not medical doctors. You don't have to go and give cytotape to someone. You don't have to go and prescribe antibiotics for PID. You don't have any right out there to prescribe, inject, and do a lot of things that you are not supposed to do it. And that is your role. If we stick to who we are, our duties and role will be elevated. But then if you go beyond our boundaries, one day, you will be found wanting. So for you to become a medical doctor, you must have additional courses. If you want it to be related to your sonography, maybe you want to become sonologist, you have to have additional years of study. And here I've indicated that at least doctors spend at least 8 years in education. But for sonographers, if you want to become certificate or diploma or other sonographers, we all get the understanding. You might spend at most 4 years. At most 4 years. If you want to specialize, then your years can increase. But automatically, doctors spend at least 8 years in education. Yes, as a sonographer, your role is to have ability to specialize in this certain kind of areas. For pediatrics, you can diagnose children. You can diagnose obstetrics and gynecological cases and give a better evaluations. We can talk of cardiology, where you study the heart and then its imaging related to sonography, the pathologies relating to sonography, images, sonographical images, and then you diagnose and assess the heart. We can talk of vascular ultrasound, where you will be able to rule out stenosis, occlusions, DVTs, and the rest, and how even the blood flows. Not only for the blood flowing, that is the arteria and then the venous systemic regulation, but again, when there is a mass, you can put your Doppler there and see the vascularization and then clarify for everyone that this mass is indeed cancerous or not, or this mass is this or that. You can also talk about neurological sonographical aspects of sonography, which is a field which deals with the nervous system. And again, it's a beautiful field where money is gained there. And you must get a fine and highly resoluted machine to do this, apply this technique. So in a nutshell, sonographers, you can specialize in these areas or you can learn more on these areas because you are needed in this area. And that is your role, to take care of the child. This is your role, to take care of the pregnant woman, to take care of this lady who is going for a lot of infertility issues. You have to take care of these patients with cardiac pathologies. You have to take care of these patients with vascular problems or the venous and arterial problems, and then indeed the neurological problems too. Now, let's switch our attention to how to become one. Now, we got to know that we are not sonographers, are not medical doctors. We have to study to acquire knowledge from all angles of, educational settlements. Here, how do we become one? If you want to become sonographer, if your relative, whatever the process is that you become sonographer, today I'm telling you criteria that you can pass through to become sonographer. And one way is to have associate degree program or to have certificate programs. It could last for a year, 8 months in Ghana, 6 months, 3 months somewhere, and even you can have someone to teach you. But then it's better to have the ones which will get you certificates. And then after that, you must license yourself as a sonographer. So the years varies. The years varies in Ghana. But for the licenses, it is 4 years. Though in some instances where someone is having the diploma or other higher certificate holding, there is opportunity for the person for the age, 4 years age, to be cut off for the person. So it depends on the certificate that you hold. I mean, those of us with certificates, when you apply for your degree, they will tell you that now you will do it 4 years. But previously, it was 2 years and 3 years somewhere. But now it is 4 years. So it varies. Then you pass through a lot of studies, which is basic science. You pass through anatomical studies, physiology, at least pathological, ultrasound pathological. You learn about the machines too, and then you become a better sonographer. So for you to become sonographer, it is all about learning, and then you must pass through a proper channel to become sonographer. So on this note, I tell some of us who have been teaching others to become sonographers, you see one day someone will tell you iliac cross and the rest. So you must direct the person to a certain channel that you think this one will help you, instead of directing the person to yourself for your personal interest. You can channel the person to a better way of getting a certificate, at least certificate or diploma, where you get yours. Which in the may year class you why? Okay. I will have family. Yes, so you need skills for you to become a sonographer, or as a sonographer, you need skills which will help you to be unique in your work. You see, we've had a lot of health workers about some characters that we, the citizens, think that they are or they exhibit, especially for the nurses. We can talk of being disrespectful everywhere, but then that is not the case. We are here. We must have a certain skills, and that skills must be for all sonographers. So we will do it with it. Being a sonographer, which you will be taking care of various incidents, taking care of personalities, a lot of personalities, you must require to have educational and training programs, obtaining certificate and other diplomatic certificates. And this one, why it is repeating and repeating and repeating, is that it is very, very important. Unless you are found wanting, you will never understand. Unless one day, when you are in the office and then there is incident of cases and other matters, that is where you understand that education is very important. So you must have good communication skills, attention to details, ability to remain calm under pressure, because this work is a bit work under pressure. We were talking about communication, and in fact, as a sonographer, when you enter into your office and whoever comes in that day, you are the Jesus for that person. If you're a Muslim that day, you are Muhammad for that person. And if you are traditional, I don't know whether you are Konfanoche or whoever that you are. So you are the savior for that person. And it starts with your communication. If you have good interaction with the person can open up and tell you whatever the case is. But then if you become a boss of your own and you sit at your office to dictate, being authoritative, the person will hide a lot of things which will go against your findings and your imaging and your understanding of the case or the scenario or what is happening to the person. So you must be a good communicator with a very good, even facial expression, and a lot must count. And that is your role. You don't have to be bossy in nature. You have to calm down and be opening for everyone to be able to tell you what is going on in their lives pertaining to the clinical medicine in terms, or pertaining to the scan you are about to do. Please, for your communications, don't go out there taking numbers and then talking outside the box apart from the work. So your communication, being good communication, must be concern of the work that you are doing, not outside the work. You should be detail-oriented. You must take very, very, very precautions. When you are switching off your machine, this is how it does. Your probe, now the probe is changing, and a lot of things. You must be detailed. Even when you are scanning and then you are seeing something, you must be detailed. Go into why am I seeing this? Why am I seeing this? So if you are able to analyze why this is happening in details, that is where you find your solutions. So those that write their report on their own, that is sonographical report on their own, you can see from their report that they have analyzed in details the pathological event that they saw on their ultrasound examination, and analyzing this in detail. Even when you did not write any impression, when someone picks your report and see that, oh, there was a well-defined cystic lesion at this area, the person will be thinking about this pathology. So you must be detail-oriented. And then for sonographers, you won't be at only consulting room, only consulting alone. No. For sonographers, the only thing that you do is not giving IVs and then tablets and the rest. But you will be consulting at the same time, examining, at the same time thinking critically to analyze and give impression. At the same time, sometimes you will be able to think and give recommendations. Sometimes you have to follow up the cases. So you become busybody. That is what we used to say, you become busybody, where every time your brain must function with the body. And then you have to go around looking for what is going on. Again, the other things that you can do too is teaching others, and it's very good to teach. We've been helped by some of our seniors who are in the field already, and that is why today too we can also talk. It has been the help of God and people. So it is people that has helped us to become what we are today. So you must also be open to help others. And then you should keep record. You have to schedule appointments. Though you should have your personal interest in somewhere, but because someone is coming for scan the next day, you have to cut off your own interest and then go for that appointment. And you must be doing other administrative tasks too ahead of your job. The other stuff is that you must have a competitive skills ability, because you are not only the sonographer in that region, that area. If you are there alone and nobody is competing with you, you are good to go. But as a sonographer, the skills that you must have, which becomes your role, is that you must be a competitive person. So if your facility is providing only ops and gyne, and someone comes around with abdominal, you must improve yourself and enter into the market with that ability. If it is vascular, you must also improve yourself. If it is about pedics, you must also improve yourself to a certain level that you can also compete with the market. It is not competition of hiding knowledge from a friend so that you become the boss in that area, but a competition that you have advanced yourself in learning process. The fifth point, which is much important to me and dearest to my heart, and then I would like everyone to take it a critical and second look about it, is constant learning. In fact, for a sonographer, you must have the ability to learn every day. Even if not every day, you must schedule yourself that I'm going to be a great sonographer, and this great sonographer that I'm going to be, I will learn. And on this note, I will tell you, buy books. So the best sonographer handout in this our area with a colored book is this one that I'm projecting to you. That if you get one and grab one, it will help you. When we meet at the SNN conference or workshop, these books will be around. Buy some. It helps a lot. Buy some. If you want some too, you can contact our admins and then you will get some. So it's very, very important to do research, Google research. You have to go to facility by facility, look at their report, look at those who are there scanning. If you hear any higher place where sonography is being hailed or praised, go there. You are doing this scan, ask the patient, ask the sonographers in charge. Please, I'm also a sonographer. I'm just raising up. I want to learn something. there is no harm and shame in learning or asking that, oh, boss, I don't know this, so please, can you help me? Sonography is all about that. If you don't know, let someone teach you. Please don't go write what you think. You should write what it is. So when you don't know, where my prof used to say, when you can see, let someone who can see it for you. So that is the skills for being sonography. And then I've highlighted that too. Here, we all know the benefits and then problems that we face. Today, I will wrap up a little bit benefits that we get and then some challenges that we face. You save valuable time and money. Here in Ghana, we have situation. And this situation is that one sonographer must take the ability to work for the whole facility, including all specialization. If it is pedis, nobody cares that you've specialized in pedis or not. The case will be brought. If it is heart, we don't care whether you are a cardiologist or whatever. The case will be brought to you. If it is vascular ultrasound, we don't care your degree, your certificate, whatever. Can you scan it? Check if this is this. Check if this is this. So everything is combined together. But then in some countries, it is being scheduled, it is being divided that, oh, at this time you are doing this, at this time you are the ops, at this time. And then if you are down for that, you are done. And that saves your time. You can attend to other business and then you get extra money for it too. You can command a competitive salary. In fact, when you advance yourself in sonography to a certain level, salary is not an issue. And I hope those who have had experience for 4 years in sonography will tell us now that they are enjoying a much valuable salary. And then you have a high level of job security since you are working under other departmental cooperatives. Your job will be secure. You have plenty of options to choose. Yes, it is a career that travels along. So it is not a static career. So you have a lot of options and then you can switch, you can specialize, you can do a lot of things to better yourself. And that is the course that you must choose for yourself. So if you're in already, happy for yourself for being in this career. You have the power to make a difference, and this is your role too. You have the power to make a difference. There is a dying soul coming to your place, and then it is you alone that can see the black and white, that can write that this black I'm seeing is a tumor, and this white I'm seeing is this. So it is you that has to make the difference for us to proceed on treating the patient. A little bit disadvantage is that in our setting and in our work, we sometimes stand or sit in a certain position which harms our eyes, our neck, our joints, and then this is disadvantage for us, though we don't use highly equipped machine which can cause a highly damage to us, but then it still does. Again, for me, I see it as a disadvantage. Everything, I would love to see new things. I would like to see new procedures. But it seems sonography job or sonographical job is all about repetition. Though it is advantageous for some people where they will have ability to rescan, and then you become perfect in that aspect. But here, I'm talking about being, if it is ops, everyday ops, we know how to manipulator probes. There hasn't been standard. You put the probe through the ear to the abdomen. It has never happened. Or you put the probe through the mouth. It is not endoscopy. So every time it is one way. And I see that as disadvantageous, but then it could be advantageous for some people. So you must get to know that someone's life is in your hands. So that one too is a kind of bit disadvantageous to me. If I must play with ordinary thing, I have no problem. But it is a life that I'm dealing with. So you must be extra careful. And if care is not taken, it is a risk for the patient and for yourself and also for the facility. You will have to struggle if you are not a tech savvy, if you are not into computer, if you are not interested in computing, where we have a scenario that we bring you the mouse and then you'll be running away and crying. If you are that type of person, I think sonography will be a bit difficult for you. It deals with paperwork. Even in these modern days that we are having the printing out and then sending the report and the rest, we still keep records and then we must print out something. And this is paperwork and it's a bit disadvantage on my side. So you work under pressure. You work under pressure. And working under pressure doesn't mean for the sake of pressure, misbehave. You don't have to misbehave because you are working under pressure. No. You must be calm and then professionally, you must handle the pressure at workplace or at every place. We have legal aspects in sonography and it's cut across in all aspects. And then the first thing that I will talk about is this legal aspect. We have the ones that is in the organization. If you are registered with Align Health, we have legal fulfillment that you will do. That is providing your guidelines and then your licenses and a lot in the Align Health. But then for us and the patient, we can talk about thoughts. And this thoughts, we have ways of describing it. If you are being sentenced to court or if we are being caught or found in any misappropriate way, the charges that will be set against you will be taught. And for explaining it as a sonographer and for our benefit, we say when sonographer fails to meet their professional responsibilities. So it can be intentional and unintentional. If you talk about intentional thoughts, we are talking about things that you did and you were aware of it. The client was aware of it and it harms the client, whether his or her personality or physically, emotionally. When it hurts the person can send you to court. So we can talk of assault, battery, invasion of privacy, and false imprisonment. This false imprisonment, on research, it tells me that even when you tell someone to shut up in your office unappropriately, it is false imprisonment because you have shutting the freedom of the person speak. And if the person sues you that, oh, the sonographer told me to shut up when I wanted to talk, you can be charged and you can be penalty for that will be given to you. And unintentional thought will be which we are not aware of it. Our actions, which we did and we weren't aware of that. So we did scan out of ignorance, and that is not an excuse for us. So you will be sent to court, and then you must come, and then someone will say, come and remove your mouth. Be you one? Yes. So you go to court, and then you explain that this is what you did and it's unintentional, and still the lawyers will proceed to at least find you. There is one thing that every sonographer who do not want any legal embarrassment must apply to his or her life daily. That is consent informed. So you must inform patient consent. Auntie, please, I want to do this. So, auntie, daddy, please, I want to do this every time. Even if the person is not available to be speaking to. That is, if the person is unconscious or whoever is around, seek it before you do the scan. Tell the person, please, I want to do this. Please, I want to do this. Whenever that your case is being said to the court, and you tell them, you inform the patient consent, whether it's written form or orally, and the patient agreed, you are a little bit free to go. But you know, most sonographers, because we are hungry and we are angry too, then we begin to go. We begin to go. Your friend was saying, we begin to go. You see, so we must seek consent. It's cut across everywhere, but it seems that we, the diagnostic, we don't do it. Even for that one is painful. So some of them will tell you, oh, I'm doing this. But for sonographers, so lie down and then take off your clothes. For the sake of that, we don't seek consent. So today we've learned that we must seek consent. In conclusion, for our lectures today, the role of sonographer in modern medicine, we've emphasized on who a sonographer is. And I've said it that if you know who sonographer is, you know your duties, you know your roles, and your roles and your duties becomes what you are giving to us in this clinical setting or in the medical field. And that becomes your role in the modern medicine. We've talked about medicine and we know a lot of incidences. Then we've talked about how to become one. You will pass through a lot of procedures. At least you must have educational understanding on the sonography, taking you through the anatomical aspects, physiological and pathological aspects, knowing the machine, that is the physics that you do. And then why must you be a sonographer? So why must you be sonographer deals with the benefits that you get from it. And again, the legal aspect of it. And this ends my presentation today. Thank you for joining and thank you for being attentive this morning. If there is any question, I'm ready to receive the question. Thank you.
Yeah. Well done, Ima. Actually, I am overwhelmed by the volume of knowledge that you have actually impacted to us this morning. Before anybody will ask a question, I would like to pass some comments. Indeed, this is a great presentation, a very great presentation. You actually hit on every angle that every sonographer has to know, and it is on point. It is on point. Well done. Now, you mentioned sonographers who prescribe. Indeed, I know some of them, and one way or the other, I have been advising them to stop because you don't have a license for that. Could you believe? And I heard you mentioned cytotech. Yes, it's very
Yes.
true. Some sonographers have been prescribing cytotech, especially that is for the young ladies like the SHS girls when they come and they take the scan. There is a pregnancy and they want to cry. Then he will quickly prescribe and take them money like 500 cedis. Um, some have even bought the box in their office, so they will give it to you at 500 cedis. Meanwhile, the thing is not even up to 50 cedis. Now, if you find yourself in trouble, that is when you know that you are not supposed to prescribe. You'll be jailed straight because you don't have a license. You don't have a license to do, even if a doctor prescribes and there is an issue with it, that doctor will be called to court and the license will be checked. Yes. And then the regulatory body will send their lawyer to come and intervene for the doctor. How much more you, a sonographer? So please, that one, a sonographer who prescribes, is just an added advice. Let's flee from that. Okay. Now for the admission into the university is very key. Yes, we all have fundamentals. So maybe you were trained by someone, you had a training 2 months, 3 months, 1 month, 6 months, 1 year. Please, you cannot have a license. In Ghana, the Allied Health Professional Law states that you need to be a graduate before you can write the license, and a graduate from an accredited institution. And that graduate, we are talking about 4 years. That is first degree. Now, if you have your let's say you have diploma from a different country, because we don't have diploma in sonography in Ghana. If you have a diploma in a different country and you bring it here, yes, then if the school is nationally or globally accredited, they will admit you into level 200 in the degree course. If you have a degree anywhere in Ghana in a health science, degree nursing, degree PA, degree medilab, degree something, and you want to do the degree in sonography, they will admit you in 3rd year. Yes, provided the school that you graduated from is accredited. Okay, but if you have certificate, nobody knows you. For certificate level, please, nobody knows you in the country. You will start from 1st year. You have to know that. Okay, so and you see, the earlier you join, the better. Please, join early, because right now there is a school, Clintabs is there. You can join. If you are not even a science student, they are willing to do access course and admit you. I am not advertising for the school, but I am telling you the real truth that in Ghana right now, if you are not a science student, that is where you have to pass to have your degree. Aside from Clintabs, nowhere again in the country. And the earlier you join, the better, because anything can happen in the future. They can change their admission process. So please, okay. How to welcome patients. You really hit on it, and I was happy with that. You see, there are some sonographers, they'll be having a fight with their girlfriends and boyfriends and wives and husbands in the house. Then they'll come to the hospital, especially government facilities. The moment a patient can even knock 5 times, this sonographer will not mind the patient until the patient like budgets in, and then the sonographer has frowned. You see, these things are not accepted. Whether you are fighting with anyone, please, when you come, you have to be smiling. The appropriate way is that even though the patient is the one coming towards you, but you have to stand and greet the patient as the patient is coming in. And you have to address the patient either formally or informally. It's all fine. Madam, please, how are you? What brought you? Oh, mommy, like you can address them nicely, let them feel at home. That's it. Don't be frowning and be too formal and then you don't smile. Please, please. That is how come some patients can easily dash you money after you are done taking care of them. They can dash you 200 cedis, 100 cedis. You see, especially when you keep on calling the, oh, daddy, daddy, because when you think he can give birth to you, like you can refer to them as that. It's normal. Or their first name is also fine. Just be okay. Let them feel at home. That's all. And also, please, workshops. You hit on acquiring knowledge. As a sonographer, indeed, you don't have to be sitting there waiting for somebody to always be teaching you. Please, always you have to read. Today, if you ask Google, how can I cheat on my boyfriend or girlfriend? Google will give it to you. So what are you waiting for? What I'm trying to say is that any question that you put to Google, Google will actually answer you. So just learn. You can go on Google, punch. If you think you have less knowledge in fibroid, go on Google, punch fibroid PowerPoint nose ultrasound. It will give you a lot of them to download. So you don't have to be seated that you don't have nose to read. No. Nowadays, modern era, no, we don't do that. So please read, attend workshops. Don't be valuing your money too much. We use money to get knowledge. Money to get knowledge. Yes. Where I'm schooling, I'm paying 25,000 Ghana cedis a year. Old cedis 250 million. That is the fees alone. My hostel is almost 10,000. But I'm paying. Please, when it comes to money, everybody likes money, but use money to get knowledge. It's very simple. Okay. Then be professional. Don't flirt with the patients when they come in your office. Don't be flirting with them. It's not that you are taking their number. You look nice. So you look nice. Mr. Of our number, please. This is to the men. This is to the men because the ladies don't do that. This is to the men. Please be professional. Be professional. If you do that, go out. Send her out and go out of the hospital and go and take the number, not at the hospital setting. Because if anything happens and you are sent to court and you collected the number at the hospital or in your room, then you'll be charged. Okay. Then also learning theory. You hit on teaching others. You see, there are some sonographers, or there are some people, and they have the how do you call it, the nose, but they would hide it. You are in the same class with them. I've experienced a lot of when we were starting this course. I was having a friend, and this guy will always hide the nose that he has. You ask him, oh, I'll give it to you. You give him pen drive. It will take you 1 year. This guy will not give you the nose. So please, if you have knowledge, share. You may not know when your family member will fall sick and will end up in the hands of that person that you were supposed to help, but you didn't. So please, you have to also be teaching others. Teach, because learning theory states that when you learn and teach, that thing that you learned and you taught someone, once you teach someone, about 90% of that thing will never leave your brain for the rest of your life. That is teaching, learning theory. Please teach others, learn and teach others, and you will never forget. Okay. And also, I'll end soon. You have to you have to also render help to your colleague. Don't think you are very busy to help your colleague. Your colleague is in trouble. There is a case, a serious case that he cannot handle, and then he or she is calling you to help. You're also in your office doing the scan. At least you can pause for like a minute or two to listen to him or her, help her out. Yes. Since you are not in classroom but in your office, you can always help her out. Yes. So finally, I will be organizing anatomy sessions when all these presentations end. I'll be organizing anatomy sessions because I know that a lot of sonographers lack anatomy. So I'll be organizing anatomy sessions for us, for SSN members. But not now, when our topics, all of them are done presenting. Yes. And then we will go through the various anatomical anatomical topics so that we wouldn't be found wanting, because if you know your anatomy, then you only need the sonographic eye and the skills to write the report. That's all. All right. So Ima, my brother, thank you very much for this excellent presentation. We are grateful. Yeah. On this note, we invite questions. If you have any questions, use the raise hand button, raise your hand, and then you'll be called. Then he will answer you. Emmanuel, answer. Yes.
Okay. To my fellow name, Mr. Gyamfi Emmanuel, you did very well. That before I say everything, I just want to say you did very, very well. So thank you for imparting knowledge onto us this morning. Dr. Patrick, I think you've be arguing no one can be episode bisa, but all the same, no one can be I will go ahead and say ask something.
Sure.
First one here, I don't know if I should ask all so that it will be answered, or I should go one after the other.
Okay, if there are 2 or 3, you can ask all of them. But if there are many, he may not recall. So if you ask 2, he will answer, and then you ask the others.
Okay, so let me first start with the TORT, T-O-R-T, which is the lawsuit against sonographers. Mr. Gyamfi, I want to know, in Ghana, is there any board that comes in defense for sonographers in terms there is a lawsuit against them? And what are statistics so far? Because it appears that, well, I have not yet encountered in Ghana, these are minimal to non-issue at court. We pray that with sonographers, we do our best as you have taught us so that none happens as far as SNA group is concerned. But is there a board? I want to know if there a board that comes in defense of a sonographer that has been sued in Ghana. And then the second one. Okay.
Okay. Let me answer that question for you, Ima. So for Ghana, you have to be under Allied Health Professional Council. That means you have to be licensed with a PIN. If you have that PIN, that means you have your first degree. If you have that PIN, that means that you are under them. So anytime you have issues, and yes, it has happened before. So it is not common. It is not common because the people in Ghana, the patients, most of them don't know their right. So even if they are being treated like inappropriately, they may not know that I should send this case to court. You understand? But it has happened before. The statistics, I don't think it's significant. It's very negligible. But then, if it happens and you are sent to court, the first thing is that the Allied Health will will be prompted. They will be prompted, and then they will look into their database and see if you are a registered person with them. If they see that you are a registered person, they have a lawyer, they have lawyers, so they will send them to come and defend you. That's it. So they will defend you everything till the case dies. Yeah. But then if
Okay.
your license has expired, because every year the thing is you have to do workshops and get credit points so that you can use it to renew your license. If it has expired and the case happened, that one, they won't intervene. They don't know you because you didn't renew your license. So you have to go and find your own attorney or your own lawyer to come and intervene for you. If it happens that Allied Health has to confiscate your license, they will do that because they don't know you at that time. Yes, so that's how it is.
Okay, thank you very much, Doc. Please, my next question is, we've talked about, which is very important, sonographers shouldn't be in the position of prescribing medications. But as Mr. Gyamfi too was presenting, he talked about how we can give suggestions to patients. So I want to know the silver line, the fine line between not prescribing. Because sometimes, like for me, it's quite similar. If, example, somebody comes and say the common cases, in 3 days, they may have fibroid and may be dranum. You know, you, as a sonographer at that point, since you are also there to save life, and we all know the dangers some of these so-called herbal concoctions or medications bring. What is the fine line from suggestion to prescribe, like prescription of medication?
Okay. Ima, are you going to take that or I should take it?
Oh, you should hammer it well for us.
So for that, suggestion doesn't really mean mention drugs. The suggestion, you have to direct the patient to the right path. Do you understand? You see, when the patient comes, as Ima said, you are like a god. Whatever you see, the patient will heed to it. So you just have to tell the patient that, oh, that means if that patient is not actually coming from a doctor, but rather maybe coming to do the scan herself or himself. If she's coming to do the scan herself, like all by herself like that, nobody instructed her to, then you can explain it to her that, oh, after scanning, I saw this, that, but I suggest that you go and see maybe an obstetrician gynecologist, you go and see a physician specialist, you go and see this, you go and see that. That's a suggestion. Some patient will ask you, oh, na herbal treatment. Then you have to quickly assert that no, herbal treatment, you don't have evidence to it. So what you know is what you are suggesting. Because those herbal people, I tell you, especially in Ghana here, it is very lucrative because they will give they will give them some concoctions. The thing will not be healed or cured, but they will still charge them. So just suggest. That is why when you are done with your report, you write recommendation. It's just a recommendation. You have to recommend. Don't prescribe anything. Yeah. Okay.
Okay. Okay. I think I will ask my last question, then maybe others will come in. The last one is before I ask the last question, Dr. Patrick, please. Emban so number why me pacho as a blast man no pay do emban so number. So that's just by the way.
Fine. It can happen. It can happen. But it's
Oh, no,
unlikely. Like it can happen, but not that common. I think if a lady will take your number, maybe you guys were discussing business or something, and then she'll quickly take your number, or maybe she knows you somewhere, or a church member, something like that. But not not necessarily like
you going
taking
debate.
your number because she is going to propose to you. African ladies
Okay, Doc,
don't normally do that. Like they propose to guys. No, African ladies don't normally do that. Though you may have someone that can do, but it's unlike them.
Okay, Doc, the info see on that. My question was the last question is relating to the literature, getting access to books. I know you've helped us with. I don't know those who were product of DHI, Kumasi, or other places. We were fortunate to have some books that are really helpful, provided if you open it and read it. But as we advance, the needs also grow. So, is there any link to PDFs we can use as sonographers? And also, as you rightly pointed out, Google will provide the information because people are putting it there. As sonographer, how do you authenticate a literature that is false? Because, people can put anything there and not everything too is right. See, how will you check and verify? So, okay, this information, with the growth of AI, a lot of things, funny things are happening. So how do we check and balance that?
Okay, so that is why you have to read from how do I say it, from authentic sources, and those authentic sources, it should be websites that are globally accepted. And the main site that as a sonographer you should be reading from is Radiopedia. They are always updated. Their notes are updated. So when you search something on Google, maybe fibroid ultrasound, Radiopedia. Once you add Radiopedia to it, it will give you that link. Then you click on it. You click on it. It will take you there, and then they will give you everything. They go into details because those that write search notes over there and the images, they are, as Ima said, they are specialists in ultrasound, sonologists. So they add sometimes the words you may not even understand them, so you have to search again to understand the words. But they will give you everything you need on such a topic. If you don't get what you, because they may not give you every topic that you search. But I think as a beginner or someone who is trying to pick up things, any topic you ask them, definitely you may have it there. Yes, that's the most widely known site that is very credible. There are other sites. There are other sites. I'll find them. I don't have them off head, but radiology something. I know of one that's also very good. I'll find out and then I'll share on the page.
Okay, Doc, we will really appreciate that. We really appreciate that.
Yeah.
Okay, I'll end my questions here for someone else to also come on.
All right. Osai Maxwell, you can ask your question, please.
Yes, I'd like to thank Gyamfi for the lecture he gave. It has really been helpful. But my colleague, he was asking of a site on the PDF books. I think there's one site, PDF Drive. PDF Drive. He can go on there. There are a lot of PDF books there that he can download.
That's fine.
And there's another one, SlideShare. But the SlideShare, you can't download unless maybe you pay. But you can go on there and read. There are a couple of also that you can go through, but you can't download. Yeah.
That's true. That's true.
And yes. my question for the lecture, are we, as a sonographer, are we in a capacity to explain the findings of our scan to a patient? That's what I wanted to find.
Have to. It depends. You see, if it's coming from a prescriber, or any health professional. You don't have to do anything. You don't have to say anything. Whether if the patient comes all by herself and afterwards the patient asks you to explain it to her, that one you can do that. But if she doesn't ask you anything, just write your report and give it to her. Ask her to see a doctor for it. That's it. There are some patients, if you don't explain anything to them, you see, they are coming from the house. If you don't, the thing is a bit of emergency. If you don't explain anything to them, they'll go and stay in the house and they'll go and die. So if it is from a doctor, then from your office, she's going back to the doctor. So no explanation needed. But from the house to your office, and the thing is emergency, or the thing is, you see that this case, if I don't say anything, this lady will go and stay in the house and wait, and something bad may happen. In those instances,
Okay.
you have to explain. And also,
But
if she puts pressure on you that yes, she's coming from the house, maybe the husband asked her to come and do it, and then she has come and then she has done it. Now what is wrong with her? That one you can explain it to her, because she came by herself. And then but you see, in the explanation, don't be saying things that are not needed. Just say what you have seen alone. Any other thing, ask her to see a doctor. Just say what you have
I get
seen.
your point. So let's say somebody walks in all by herself, and maybe she's coming for an obstetric scan, and maybe you find out of an IUFD. How are you going to explain to her?
Okay. So for IUFD, it can cause a psychological trauma. We call it some partum blues or postpartum blues and co. And so sensitive cases like that, though it is not going to kill her if she goes back to the house, but then it can have a potential of harming her when she goes and stay in the house for long. So it's better you tell her that there is a problem with the pregnancy. Please visit the hospital as early as possible. Just tell her that, and then she'll go. Say something that will cause her to visit the hospital. But if you go straight, like some of them may go into psychotic sort of state. Do you understand? Because it could be that she has been looking for pregnancy for the past 15 years, and this has happened. So a case like this, she needs to see a doctor. The doctor, after listening to her, her ordeal, the doctor may also refer her to see a psychologist in the same hospital. The psychologist will psych her very well before they will tell her. That's the best way to go about it.
Okay, thank you.
All right, welcome. Any other question? I don't see any hand raised. Okay, so if there are no further questions, we will thank our brother Mr. Gyamfi again, and then we will call this a day. We will end it here. Thank you all those who joined. Yeah, thank you all. Mr. Gyamfi, please forward the file into my DM so that I can share.
Oh, okay.
Yeah, and the recorded video will be posted on the page, on the Telegram page for access. All right, thank you all. Have a nice day.
Thank you. Yeah, thank you.